Hello, everyone. My name is Romaniel Hernandez, and I'm here today with Megan Panikar and Alexander Martin to do our presentation titled The Future of U.S. Healthcare Curriculum Changes Needed. Nursing programs are not the same they were 20 years ago or even 10 years ago. Many aspects of healthcare have changed, including patient population demographics, socioeconomic status changes, emerging technologies, as well as new health conditions and diseases. Nursing schools and nurse educators have had to adapt to all these changes in order to remain up to date in today's fast-paced and ever-changing healthcare system. In this presentation, we'll be discussing what we expect the next 10 to 20 years will look like in the U.S. healthcare landscape, as well as proposed curricular changes that we believe will better prepare UNLV School of Nursing for the future. My colleague Megan will now discuss the role of emerging technologies and staffing shortages.
Thank you, Roma. Emerging and developing technologies such as artificial intelligence, virtual reality, robotics, and genomic profiling have the potential to change the U.S. healthcare system as we know it, along with the way nurses and students learn new concepts and practice nursing. Artificial intelligence, commonly referred to as AI, is a computer simulating the characteristics of human intellectual processes, such as the potential to rationalize, apprehend, simplify, or analyze, and can be used in the healthcare system to help with an array of diagnostic and therapeutic applications, such as combing through medical records, designing treatment plans, and helping with identifying diagnoses. AI was used recently to detect breast cancer for lymph node biopsies and was able to achieve higher tumor-sensitive levels than pathologists. Virtual reality, or VR, is being used to help train surgeons performing complex surgeries. It can also be used to help distract patients from painful procedures by providing visually relaxing landscapes. Robotics is currently being used to aid in surgeries and are being further developed to include pharmabotics and disinfectant robots. The Human Genome Project, funded by the U.S. government, is underway and is working on genomic sequencing to provide valuable genetic information such as drug sensitivities, medical conditions, and family history to help patients become aware of their risk factors and take preventative actions to better their health. As you can see, there have already been so many advancements in healthcare technology. In the next decade, it is predicted that technology will further assist healthcare professionals with personalizing healthcare, examining genomic profiles, and social determinants of health to detect diseases and recommend personalized treatments for patients. We project that these new technologies will play a major role in nursing education, which will positively affect chronic disease management for our patients and assist nurses working in acute care to optimize patient care plans. There is evidence some of these are already being used in nursing curricula across the country, so it is in our school's best interest to incorporate them in our curriculum in order to better prepare our students for the future of nursing. Another change that is expected to happen in the U.S. is an increase in shortages for nurses and nurse educators. We are currently facing a shortage in the nursing profession as well as the nurse educator workforce. According to the Association of Colleges of Nursing, over 65,000 nursing applicants were turned away in 2023 due to an insufficient number of faculty, clinical sites, classroom space, and/or budget limitations. Additionally, the AACN reports that in 2023, there were 1,977 vacancies within 922 nursing schools in the U.S. We expect the shortages to increase exponentially in the next 10 to 20 years. According to the U.S. Bureau of Labor Statistics, the nursing workforce is going to be adding around 177,000 jobs in the next 10 years, which is still 15,000 nurses short based on the growing population and the number of nurses retiring or leaving the profession altogether. The AACN projects there will be a shortage of nurse educators due to many reasons, including aging and retirement, decline in doctoral and master's student enrollment, as well as better compensation and benefits packages in clinical practice versus academia. One of the proposed curricular changes we recommend is to add a nursing artificial intelligence course to our plan of study. AI as we know it is a blanket term for all things that advanced computerized systems can do to help humans. One study found that incorporating an AI course in their nursing program positively impacted student readiness to learn how to use AI tools and become versed in this technology. AI will transform nursing across many domains of practice, including critical care, policy and research, education, and administration. Adding this course to our program here at UNLV will help nurse educators familiarize themselves with AI and will help nursing students adapt to this emerging technology as it develops, which will prepare them for future use at their place of employment, making them a valuable addition to the nursing team. One proposed curricular change to combat the nursing shortage is to increase the availability of distance learning via online education through a blended learning curriculum. Online education programs can increase student enrollment because online classes are not bound by the size of classrooms. Furthermore, many students may have to work jobs to care for themselves and/or provide for their families. Offering an additional online BSN program in which didactic courses are taught online provides these students with the opportunity to pursue a degree by helping balance their schoolwork and home life, thus helping to increase nursing enrollment and address staffing shortages. In addition, nurse educators who work other jobs may find online teaching adds flexibility to their busy work schedules. To address the clinical component of the nursing program, we can implement clinical hours in various ways. Clinical hours are imperative for adequately preparing graduates for the nursing profession. Virtual simulation can be used to help prepare students while they learn away from campus. However, the National Council of State Boards of Nursing recommend only up to 50% of clinical hours should be substituted for online and simulation activities. In order to ensure students develop their clinical and critical thinking skills in practice, students will need to complete clinical hours in the hospital and lab settings. In the next slides, my colleague Alex will now discuss future U.S. demographics and emerging diseases and health conditions.
Thank you, Megan. Next, we will examine the future U.S. demographics. America is gray, a new U.S. Census report states. Alarmingly, by 2030, it is projected that 1 in 5 Americans will be over the age of 65. This transition of the last baby boomers retiring will compound staffing shortages that we see here in the United States healthcare system. This problem is further exacerbated by a shrinking reproductive rate, which is creating a phenomenon of shifting from a youth-dependent society, or a society in which most of its dependent members are toddlers, children, things of this nature, to an adult-dependent society, right? So a society where most of our folks are in nursing homes and skilled nursing facilities and things of this nature. And this will be the first time we've ever seen this in United States history. Interestingly, by 2030, international migration is expected to be the largest driver for population growth, which is as opposed to natural birth rates. This migration, in conjunction with overall higher birth rates seen in minority populations, will further create a pluralistic population, or a population consisting of multiple ethnicities, backgrounds, and beliefs. Breaking it down by race and ethnicity, for the next 1 to 2 decades, whites are still projected to be the majority of Americans, albeit at a decreasing number, with the number of Hispanics, Blacks, and Asians all projected to increase. These changes have implications for the disease processes that we will be seeing in the next coming years. On this slide is a beautiful illustration of the changes we can expect to see over the next few decades. As a result of the overall increased number of older adults, we will see a continued increase in diseases related to advanced age. Volset et al. Has done extensive research examining disease prevalence and cause of death and creating a projection on what the future holds. One remarkable shift that we see from this data collected is that the leading cause of death in 2050 will be all age-related. This includes diseases such as ischemic heart disease, stroke, diabetes, and COPD. This will be the top 4 things that kill globally. This is directly opposed to the early age mortalities, such as birth defects, which we see in current day, which is the second leading cause of death. Statistically, this makes sense since our demographic projections demonstrate a decreased birth rate combined with an overall increase in life expectancy. It is also important to consider that some birth rate related diseases will have decreased mortality due to increased healthcare access in multiple countries as these countries continue to improve their standard of living and help their citizens rise out of abject poverty. And so, with this all said, this leads us to the question of what should the teachings of our future nursing programs include? Considering the demographic and disease prevalence changes we will see in the United States, a major consideration going forward for developing nursing curriculums should be the emphasis, of course, of the geriatric population. Major learning objectives for the geriatric population include deconstructing biases and teaching students to actively listen. Additionally, the abilities for students to analyze the physiological, pathological, and psychological changes of aging are all relevant topics. These learning objectives can be met with learning activities such as problem-based learning, role-playing, and simulation-based learning. Of note, out of these three, simulation-based learning is very effective when it comes to changing the attitudes that students have towards the elderly, while problem-based learning is very effective in enhancing knowledge mastery. Hence the inclusion in both of our suggestions to make a well-rounded curricula. The next curriculum change that we should implement is the inclusion of cultural sensitivity. Cultural sensitivity is already a core competency of many nursing programs thanks to accreditation agencies such as the American Association of Colleges of Nursing. Evidence provided by the Institute of Medicine further demonstrates that an effective way of combating cultural disparities seen here in the United States is by implementing cultural competency in nursing education. Curriculum and cultural diversity is best implemented in a hands-on, effective experiential learning experience, such as storytelling, community outreach programs, and clinical simulation. Now, with cultural sensitivity, the goal is not necessarily to teach students about all of the different cultures that they may encounter. While it is good to try and give them a basis of understanding really what cultural sensitivity is about stressing the importance of listening to your patient and getting a better understanding of where they're coming from. So that way we can create patient-centered care. So, for example, with clinical simulation, the simulation experience would be dedicated more on being culturally sensitive. And so examples of this include if a patient is a Jehovah's Witness, but they need a life-saving blood transfusion, and how the nurse will facilitate that conversation and reach a agreeable outcome with the patient. Another example is having a patient who is transgendered on hormone replacement therapy and the implications that that has to how we talk to this patient and what pronouns we use and how to initiate that conversation and things of this nature. So to close out and to summarize our points, I'm going to pass it over to my colleague Roma.
Thank you, Alex. As my colleagues have discussed, there are many emerging technologies such as AI, virtual reality, robotics, and genomic sequencing that are projected to have a profound impact in healthcare. Additionally, changes in demographics and an increase in multicultural diversity, along with shortages in the nursing staffing and the nurse educator field, are important trends that we must keep in mind when updating curricula. We have proposed several curricular changes that aim to prepare UNLV's nursing program for the future. These include adding an AI course and a distance learning option for our BSN program, as well as emphasizing geriatric care and cultural sensitivity. In order to keep our competitive edge, UNLV must remain innovative and evolve our curriculum to fit the current and future needs of the community in order to equip our students with the appropriate tools and education to provide higher quality care for our community. And that concludes our presentation. Here's a list of our references, and thank you for watching.